In this video, we're going to talk about the item 1033, risks for hospitalization. This item is important for two reasons. Number one, it identifies the potential issues a patient may have that can cause them to be readmitted. And we have to identify this information for the conditions of participation on our plan of care that we are identifying these items and have interventions in place. The second thing is this is important for a patient-driven grouping model, that we understand which potential items could cause a patient to have issues and establishes a payment. So it's important that this OASIS item is fully understood. The item has 10 questions that you can select. We're going to take a look at each one of these. The item intent is to look at the risk for hospitalization, which we discussed, and the time points that this is completed is during a start of care and resumption of care. For the first four items, they have a certain time frame associated with them when you're assessing these measures. So history of falls and weight loss are over a 12-month period. And note that the weight loss is 10 pounds or more during that period of time. Hospitalizations and ER visits are over a 6-month period, and both of those have a threshold of 2 or more visits there, as well as in the falls it says 2 or more. So make sure that you're paying attention to these time frames, and when you're interviewing a patient, you're getting this correct information. Also note that falls are both witnessed and unwitnessed falls when you're assessing this item. With regards to answer 5, it looks at the change in a mental, emotional, or behavioral status that's declined in the past 3 months. So take note that there is a 3-month time frame. And also be aware that most patients are not going to outrightly admit that they have issues in these areas. They may, but you have to observe the patient and also interview the family members or caregivers that you come across. So when you're assessing this item, make sure you drill into all the sources of information. Number 6 looks at compliance with medical instructions. In this item, if any patients can be admitted to home care, it is likely they're going to have issues with complying with medical instructions. There's examples given of medications, diet, exercise, but this is going to be much more broad. It can include simple things as not using a walker, not following the instructions to take their weight every day, doing home exercises, any type of safety issues, the list can go on. So most likely, majority of patients are always going to have this item checked off. Response 7, the main takeaway with this is besides prescribed medications, make sure that the over-the-counter medications such as Tylenol or ibuprofen or vitamins are also being considered. Number 8 looks at exhaustion. Now in this item, there's a Q&A from Medicare which says what identifies exhaustion? Is it physical or mental or both? And the answer to this is that it is both, physical and or mental responding. So you must be able to interview the patient and get a sense of either one of these descriptions of exhaustion. Keep in mind it's the day of the assessment or 24 hours preceding. The last two items we're going to look at is 9 and 10. 9 is often overlooked, and keep in mind this is really anything else that clinician sees when they go to that house. So you have to look at the environment when you're walking to the home, when you're in the home, observe the behaviors of the patient. What's the environment of the home? Is the air conditioner not running? Is it hot? Is it dirty? Is it cluttered? Loose railings, dogs running around, grass is real thick when they have to walk outside, no sidewalks for them to get to their cars safely. There could be a various amounts of things you examine. So make sure that this item is closely looked at by all the clinicians going to the home there. In 10, the last one says, out of all the items that have been considered, there's none found. I would find this highly unusual that patients wouldn't have risks involved. Particularly, many of these things here are things that you're normally going to come across during a home care admission. But if they didn't have anything that was a risk, then certainly 10 would be checked here. If you have any further questions on answering this item, contact your clinical manager, directors of clinical services to get further clarification. Thank you.